Well, good morning, good afternoon, or good evening, or perhaps good night to some of you, depending on where you are in the world at the moment. My name is Lars-Åke Söderlund, and I am the president of the community pharmacy section in FIP. And on behalf of the International Pharmaceutical Federation, FIP, I want to welcome you all to this webinar, an overview of current pharmacy impact on immunization. Our eminent speaker, Mr. Gonzalo Sousa Pinto, will share the results from the findings of FIP's latest survey on pharmacies' impact on immunization coverage, released 2 days ago. A total of 99 countries and territories participated in this survey, making an overview of pharmacies' impact on immunization coverage, a global survey, the most comprehensive report published on this subject to date. Before we continue, let's go through the webinar house rules. Regarding this webinar is being recorded and live streamed via Facebook. The recording will be available on our website, www.fip.org, and you may ask questions using the questions box. Please use the questions box in the Zoom tool, because otherwise we will not be able to track your questions. So please use the Q&A box. And of course, you are welcome to provide feedback to this session on webinars@fip.org. And of course, I would like to invite you as well to become a member of FIP. Regarding becoming a member of FIP, please note that the different fees for memberships apply depending on the country where you live. And it is, and especially in these times, a very good investment to become a member of FIP. So please do register at the website later. I would also like to thank GSK and Sanofi for funding this very important study that will soon be presented at this webinar by Mr. Sousa Pinto. Community pharmacies, they have a key role to play in supporting healthy aging and the maintenance of a good health and quality of life across the life course. Overall, we can say it's about developing and delivering primary healthcare strategies in collaboration with other healthcare professionals and patients as well, that will develop a more accessible, more sustainable healthcare system, leaving no one behind. And pharmacy, we have a widespread distribution and accessibility. We have close relationships with and knowledge of the communities we serve, as we are in the heart of our communities. We have long opening hours, and in most countries, we have teams of highly qualified health professionals. There are three core areas in which pharmacy plays a key role in healthy aging and primary healthcare, and they are effective management of NCDs, growing in all parts of the world. We have the promotion of vaccination and immunizations, and support of adherence to treatments. But as we have experienced during this year, public health and communicable diseases and outbreak preparedness response is of high importance. For example, the coronavirus outbreak, where pharmacists all over the world have been at the front lines in fighting the pandemic. FIP has a long and sincere commitment to improving vaccination coverage. I will just briefly go through the development from 2011, highlighting for you our strong dedication for vaccinations, immunizations, and at the same time developing pharmacy, healthcare, and the possibility for healthy aging. Well, actually, it started in 2011 when we developed the FIP WHO GPP guidelines, administration of medicines, vaccines, and other injectable medications, defined as a key role for pharmacists. Followed in 2016 by an overview of current impact on immunizations. And further on in 2016, the leadership conference at the FIP Congress in Buenos Aires on vaccination. In 2017, we launched a new survey report, Pharmacy, a Global Overview, where we also covered pharmacy-based vaccination practices. And in 2018, the Amsterdam Summit, the pharmacist role in immunization, advocacy approaches. Further on in 2018 at the FIP Congress in Glasgow, we had a policy conference on vaccination with the WHO, the International Federation on Aging, and the International Longevity Center and other partners. And in 2019, FIP joined the steering committee of Immunization for All Ages Coalition. As you can see, many different actors is part of this coalition. And in 19, also we launched the FIP Global Vaccination Advocacy Kit. In 2020, we relaunched the same document, but now for public. In 2019, it was for member organizations only. And today we are going to talk about the new survey on the role of pharmacists in improving vaccination coverage. And next year we will also be part of a long-term strategy together with the WHO, as FIP has advocated at multiple WHO governance meetings, as well as regional and national pharmacy conferences for our expanded role when it comes to vaccinations. Some of the key advantages of involving pharmacy in immunizations and vaccinations are access, proximity, our extended hours, especially when others are closed, our ability to identify high-risk patients easily based upon their medications, people's trust and enthusiastic acceptance all over the world where vaccinations have been launched, practice guided by naturally adopted guidelines, and of course, support of multi-dose vaccines, not only flu vaccines. We have a knowledgeable vaccine resource, we have lots of education and training, and we also, of course, have the ability to handle storage issues as well. And here we can see actually the case for pharmacy involvement. Allowing pharmacy vaccination improves efficiency and increases vaccination rates. Pharmacies provide services much closer to patients' homes or offices, and they can obtain vaccines at more convenient hours, such as lunchtime, evenings, or when it is convenient for the patient. And pharmacies frequently administer vaccines at lower costs than doctors' offices or medical clinics. It's about giving care at the right level of care. And of course, we can improve access to healthcare in rural and medically underserved areas. And as I mentioned before, another key advantage is that pharmacy can easier reach patients at risk, for example, the vulnerable, elderly, or those suffering from NCDs. There is no question that immunization is one of the greatest success stories in global health, saving millions of lives every year from vaccine-preventable diseases. Every year, more than 116 million of all infants, 86% of all infants are vaccinated. And more than 20 life-threatening diseases can now be prevented by immunization, and new vaccines for major killers like diarrhea, cervical cancer, cholera, and meningitis are quickly being introduced in countries that did not use them previously. And as you can see, this is a case for pharmacy, where we are doing a lot, but where we also can do a lot more. So it's about saving lives and protecting the health of populations. It's about improving countries' productivity and resilience. It's about enabling a safer, healthier, and more prosperous world. A world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. The new Immunization Agenda 2030, which sets the vision and strategy for 2021 to 2030, co-created with a number of global organizations, is actually a strategy that are relevant for all countries to break through on stagnation in reaching children not vaccinated and fight against vaccine hesitancy. It also aims to build stronger surveillance systems for vaccine preventable diseases, particularly for identifying, tracking, and monitoring disease outbreaks and sustaining research to ensure we are poised to meet the challenges around the corner on outbreaks, antimicrobial resistance, infections for which our vaccines are inadequate, and size opportunities to tackle diseases for which there are as yet no vaccines. And for the first time, the new vision expands the global focus for immunizations to all age groups, not just children. So while this shift will shift immunization programs, it will also allow us to rethink and strengthen people-centered care to ensure vaccines are taken up by older age group. And actually, as you can see on this slide, we don't have time to go through it, but this immunization agenda is linked to 14 of the 17 Sustainable Development Goals. In 2019, FIP launched an advocacy toolkit to support national patient or pharmacist organizations to actually introduce and expand pharmacy-based vaccines-related services. It's a source of global data, evidence-based practices, and expertise that are required for effective advocacy in your own country. It's an excellent publication we can use to learn, share, and adapt in your own countries. And of course, it's available for all FIP members via the FIP website. When it comes to this webinar, you should be able to understand the evolving roles that pharmacists play around the world to improve vaccine confidence and vaccination coverage, the current situation with regards to pharmacy practice and regulation in the area of vaccination, and the gaps and challenges that require the attention of pharmacy organizations to develop these roles further into the future, as it is a part of primary healthcare as well as universal health coverage. So let's now turn over to the presentation, an overview of pharmacy's impact on immunization coverage, a global survey. And the speaker, it's a pleasure for me to introduce Mr. Gonzalo Sousa Pinto, FIP, Lead for Practice Development and Transformation. Gonzalo has been highly involved in the development of many of the publications we saw earlier about vaccinations and in immunization, and is indeed an expert in this area. Welcome, Gonzalo. The stage is yours.
Hello, everyone. Thank you very much, Lars-Åke, for this introduction. Definitely, it sets a good starting point for presenting the findings from our recent survey. And going back, so as Lars-Åke was just saying, the report was launched formally 2 days ago on the 4th of August, and it's called An Overview of Pharmacy's Impact on Immunization Coverage. And it's the outcome of a global survey conducted by FIP. The report is now available at the FIP website on this specific address, so /file/4751, and then you will be able to access, or if you go directly to our library of publications, you will find it there as well. As Lars-Åke was mentioning, the WHO has listed over 26 infectious diseases that can be effectively prevented by a vaccine currently. And in fact, the WHO states that vaccines are second only to clean water when it comes to their effectiveness in preventing disease and their impact on public health. Immunization currently saves an estimated 2 to 3 million lives every year, and the WHO estimates that an additional 1.5 million deaths could be avoided if we expanded global vaccination coverage for several diseases. We now have more diseases, and our arsenal of vaccines is increasing, and we now have vaccines to protect against malaria, dengue, and Ebola virus disease. But also other vaccines are in the pipeline, with very promising results so far, including the respiratory syncytial virus, tuberculosis, all influenza virus strains. And of course, as we know and heard on the news, there's very promising results also in terms of the development of vaccines against COVID-19. Increasingly, also vaccines are protecting health beyond infancy. The focus of many of national vaccination schedules and strategies has been on infancy. And so vaccination has been largely associated with vaccinating children and adolescents and babies, but we are shifting the focus towards vaccination throughout the life course, because there are important diseases that cause a great burden of morbidity and mortality and loss of function in adults and older adults in particular. So this change of focus from vaccination only for children and babies and adolescents to a vaccination throughout the life course approach is really imperative. And the WHO has developed the new Immunization Agenda 2030, which builds upon and addresses the gaps left by the previous strategy, and which was the Global Vaccine Action Plan 2011 to 2020, that closes this year, let's say. And the new immunization agenda is set to be approved by or endorsed by the World Health Assembly later this year, and will become effective at the end of 2020. And this immunization agenda sets an ambitious and overarching global vision and strategy for vaccines and immunization for the next 10 years. And I included this quote from this document, this important document, that says that through collective endeavor, countries and partners will achieve the vision for the decade: a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. So as you can see, this quote introduces this change of focus of vaccination strategies to include the age and the life course approach to vaccination policies and strategies. Vaccines are critical to the prevention and control of many communicable diseases, and therefore they underpin global health security. We have all seen what a world without a vaccine for COVID-19 can look like, and the impact that has on global health security, on global economies, on people's lives, unemployment, poverty. So vaccination is an incredibly effective way of preventing all that harm and underpins really global health security. It's also critical for addressing emerging infectious diseases and for containing or limiting outbreaks or combating the spread of antimicrobial resistance. And as Lars-Åke was also saying, antimicrobial resistance is one of the great challenges of our time. And of course, through effective vaccination, we reduce the need for antimicrobials, and therefore the vaccination is very closely linked to the fight against antimicrobial resistance. And according to WHO, vaccines will help keep an estimated 24 million people around the world from falling into poverty in the next 10 years. Some of the strategic priority goals of this World WHO immunization agenda, and of course I will not be going through all of them, but I just wanted to highlight, for example, strategic priority goal number 3, where everyone is protected by full immunization regardless of location, age, socioeconomic status, or gender-related barriers. So again, all these removing, reaching the hard to reach, including all ages, including all people, leaving no one behind, in immunization strategies, and giving people the opportunity of living full, healthy lives in full function throughout their lives. And under strategic priority goal number 4, all people benefit from recommended immunizations throughout the life course, effectively integrated with other essential health services. And one of the objectives under that priority goal is to establish integrated delivery points of contact between immunization and other public health interventions for different target age groups. And I have highlighted this one because, as you can imagine, there's a direct relationship of how pharmacists can play a role in that objective of this 10-year strategy. But now, this was just sort of a preamble so that you understand why FIP is also placing such a strong focus on vaccination advocacy and how pharmacists can contribute to improving vaccination coverage. And 4 years ago, FIP conducted a global survey, and we published our first report in this area that was authored by Dr. Helena Rosado and Professor Ian Bates. And this year, we have launched a similar survey that was based on the questionnaire from last year, from the last survey 4 years ago, but including some new questions and sort of tweaking the survey here and there. And the authors of this survey were Matthew Hung and Audrey Wong, in addition to myself, to whom I thank, of course, the collaboration of Matthew and Audrey in producing this publication. The aims of this survey, of this study, was to gain a better understanding and to obtain current data on the following topics. On firstly, the role of pharmacists in promoting vaccination awareness and uptake and advocating for vaccination. So in addition to administering the vaccine itself, there's a number of roles that pharmacists can play, and we will be discussing those later in this presentation. Also, the second point is the regulatory and contractual frameworks for pharmacy-based vaccination. This includes the legislation, the authority where the pharmacists are legally authorized to administer and provide vaccination services, but also contractual aspects, including the reimbursement of that service, for example. Then under point 3, administration of vaccines. This of course includes the range of vaccines that pharmacists can administer, but also the age groups that can be vaccinated at pharmacists, for example, or population groups and age groups, and who, for example, is accountable for the administration of the vaccine, and actually what professionals are authorized to administer vaccines at pharmacies, because it's not always the pharmacist that does that, as we will see. In point 4, the training, of course, for these roles of the pharmacy workforce. On point 5, vaccination records, how pharmacists have access, what level of access they have to vaccination records, not only in reading rights, let's say, or access to the information, but also access to inputting information into these records. And finally, we'll also analyze in this survey what are the main perceived limitations to the development of pharmacists' roles in vaccination. And since we had a baseline for this study that was established 4 years ago with our first survey, we also wanted to identify the developments in this area, how the situation has changed, and also we included some questions about that will allow us to think or to estimate what will be the developments over the coming 5 to 10 years. And I will be presenting the data for that as well, which is very encouraging and very exciting. So you know, the survey was conducted between December 2019 and March 2020 in 5 different languages: Arabic, English, French, Russian, and Spanish. And I take this opportunity also to thank our colleagues and volunteers who supported FIP with these translations. We invited a total of 141 pharmacists organizations in 112 countries to participate in the survey. And we received responses from 106 organizations in 99 countries and territories. We were hoping to reach 100 so we wouldn't have to calculate so many percentages, but 99 was, we were very happy that we had such a high response rate, which was 88.4% of all the countries that were invited to participate. As Lars said, this sample makes this the most representative study ever conducted in this area. And in fact, it's so representative that the population of the countries that are represented in this study actually accounts for 83% of the world's population in 2019. So as you can see, this scenario, that this survey describes the population, the situation of the role of pharmacists in vaccination for nearly over 80% of the world's population. This is a map of the countries that participated in this study. So as you can see, it's very widespread across all regions of the world with a high participation. So we're going into that first point in terms of the pharmacist's roles in immunization, and this is beyond vaccination administration itself. So pharmacists have a role as educators in providing evidence-based information and advice, as advocates and promoters of vaccination by engaging in campaigns, sometimes only pharmacists, sometimes multidisciplinary campaigns, by identifying and advising high-risk patient groups on about their vaccination needs, and also serving or advising immunization committees, for example. They also play a role as facilitators by managing vaccination schedules and appointments. Of course, they have the storage and supply capacity, including supply chain management. They have roles in vaccine administration in many countries and in keeping vaccination records. So the map on your screens shows the total number of countries where pharmacies play some role in terms of vaccination and promotion of vaccination and in vaccination advocacy. And that's in a total of 86 countries, which represent 92.5% of all respondents. And these roles, what we see is that there are two main types of roles in terms of vaccination awareness promotion and advocacy in terms of uptake of vaccines. And there's two types of roles, one of them being more generic or more passive roles, let's say, by distributing vaccination leaflets or participating in campaigns, posters at pharmacies, or providing general information to the public. And then there's a different type of role that is more patient-focused, that is more customized, that involves, for example, verifying a patient's immunization status and advising a specific person, let's say, on their vaccination needs, identifying patients or groups that may be at a higher risk of certain disease-preventable, vaccine-preventable diseases, and advising them, and serving on immunization committees and immunization advisory committees. And what we see is, of course, that the roles of pharmacists in these more generic roles are more common, but there's definitely room for improvement in increasing our participation, our proactive advice to individual patients based on more customized roles. Of course, this is linked to access to vaccination records, so we will come back to this at the end of my presentation. In terms of the regulatory and contractual frameworks for pharmacy-based vaccination, and this was a very encouraging result, we see now that pharmacy-based vaccination is available in at least 36 countries and territories, and that's 16 more than our study in 2016 found. So that's very encouraging to see that. And we through these countries and through this through our pharmacies in these countries, we can reach a population of almost 1.5 billion people that can have access to pharmacy-based vaccination, and that's almost twice as many as in our 2016 study. In terms of vaccination by pharmacists, it is authorized in 26 countries out of those 36. And that's twice the number of countries that we had found in 2016, which were 13 exactly. What we also saw is that in our sample, 66 countries and territories do not have pharmacy-based vaccination. So there's still a long way to go in terms of achieving this authority for pharmacists and enabling our contribution to improving vaccination coverage. But an encouraging result, and I will be showing that in a couple of images after this slide, is that out of these countries that do not currently have pharmacy-based vaccination, we saw that 16 of those are actually discussing or proposing or developing new laws that will allow pharmacy-based vaccination. And that's a very encouraging result, because that could bring, in the next 1 to 5 years, the number of countries around the world where pharmacies can vaccinate up to 52. So that's a very big development, a very big increase. So this is the current situation, and we included not only the 99 countries in our sample, but 2 more that did not participate in the study, but we know for sure that they have vaccination, pharmacy-based vaccination. So in 101 countries, we have this global distribution, and the countries colored in yellow are those that do not have pharmacy-based vaccination, and those in the darker shade of blue is where pharmacy-based vaccination is authorized, but only other healthcare professionals can provide it. A doctor or a nurse usually that comes to the pharmacy to provide the vaccine, to administer the vaccine. And this is the list of countries that have pharmacy-based vaccination and a comparison between 2016 and 20. And we won't go through the whole list, of course, but the ones that are colored in the darker blue is the ones that we have confirmation that they changed their situation from 2016 to now. So there's a confirmed change of status, let's say. And for those in the lighter shade of blue, we did not have data from 2016. They had not participated in our study, but now they do have pharmacy-based vaccination. So that's also very encouraging. So with the following images, you can see this was the situation in 2016, and this is the situation in 2020, and this could be the situation in 2025 if all the changes that are being currently discussed in legislation become a reality, let's say. In terms of reimbursement for vaccination services, it's important to consider that reimbursement mechanisms for pharmacy-based vaccination are linked to policies and strategies to foster equity in access to vaccination services. And it's also linked to sustainability of the service itself. So, and of course, the impact and the consequence of having reimbursement by a third-party payer for the vaccination service, it has a direct link, of course, to vaccination coverage, because more people will be able to come to a pharmacy and be vaccinated without having to pay for the service from their own pocket. And in our survey, we also asked our member organizations and respondents how important it was, or they considered the reimbursement for vaccination services. And our respondents considered, well, nearly 80% of respondents said that it was an important or very important aspect of this issue. And what we see is that, and in this infographic, in this image, you can see that the majority of countries within the group of countries that have pharmacy-based vaccination, in the majority of countries, the service is paid by the customer. But we also have 10 countries where it is reimbursed by public health systems, and 5 where it is reimbursed by private health systems. So these figures do not add up to 33, which is the size of our sample for this specific question, because of course countries could select more than one option. More than one of the systems can be present and is present in many of our countries. But we also have 6 countries where the service is provided free of charge, both to the customer or patient, but also it's also to the health systems. So basically this means that the service is being funded by the pharmacy itself. And the different colors in this column, in these columns, represent the income level of countries. So what we can see is that in countries where the service is reimbursed by a third-party payer, we see no countries at all from low or lower middle income levels. And of course, in these countries, the service is usually paid by the customer. And in one case, it's also funded by the pharmacy and is provided at no cost. In terms of the vaccines that are administered, we asked about 36 different types of vaccines, and we had at least a few responses for all of them, which means that pharmacies are involved in the administration of 36 different types of vaccines, at least in some countries. And among 34 respondents with pharmacy-based vaccination, 71% that reported that pharmacists may not prescribe vaccines. And this is a hindrance, of course, to improving vaccination coverage, because if a customer or a patient needs to go to a doctor to obtain a prescription for a flu vaccination, for example, and then go to the pharmacy to be vaccinated, of course, we might be missing out on this person if it becomes too cumbersome and too complex for them to to obtain or to get vaccinated. Pharmacists are accountable for the vaccination process in different capacities, either as the professional who administers the vaccine or as the manager of the pharmacy or the owner of the pharmacy in nearly 80% of the cases where pharmacies can provide vaccination services. And here you see the most commonly administered vaccines, the 15 most commonly administered vaccines at pharmacies. And unsurprisingly, the flu vaccine is the most commonly administered in 29 countries out of 31. But we also see several other vaccines that are key, especially for adults and older adults vaccination. And we see pneumococcal and meningococcal vaccines. We see shingles here, and of course, pertussis and other vaccines that are essentials throughout the life course. Tetanus, of course, is always there, or in many cases, and hepatitis B as well. In terms of the population groups that can be vaccinated at pharmacies, in 96% of the cases, of course, pharmacies can vaccinate adults and older adults, but also pregnant women can be vaccinated at pharmacies in more than half of the countries that have pharmacy-based vaccination. And in 44% of the sample of the respondents to this specific question, also babies, children, or adolescents can be vaccinated at pharmacies. In terms of the training for vaccination services, an interesting finding is that, of course, among the 35 countries that responded that have pharmacy-based vaccination, in all of them, pharmacists can obtain their training to become competent to vaccinate as a postgraduate continuous professional development courses or training and education. But also there are 16 countries, and that's 46% of our sample, that have already included the training for pharmacy, for vaccine-related services in the undergraduate education of pharmacists. So this is a very interesting development. 16 countries out of 35, but we do hope that this will become sort of more mainstream as part of the foundational training and education of the pharmacy workforce, to include those knowledge and skills for vaccination delivery. In terms of the vaccination records, regrettably, through our survey, we understood that pharmacists do not have access to vaccination records in most countries and territories. So 67% of the entire sample, pharmacists do not have access to vaccination records. And this, of course, prevents pharmacists from having a more proactive role in advising about vaccination needs of patients, in checking their vaccination status, in identifying risk groups, and if they have received the vaccinations they need specifically for their risk situation, let's say. And even in countries with pharmacy-based vaccination, full access to vaccination records is available in only 12 out of 33 of those countries, with the remaining 21 respondents saying that they have access to some records only. And in nearly half of the countries with pharmacy-based vaccination, pharmacists do not possess the authority to record vaccination details in a shared vaccination record. Again, this is a major hindrance or a barrier, because of course, if pharmacists can input into these vaccination records, and it's a shared record with other health professionals, they will of course be able to see the changes to the vaccination status through the administration of new vaccines or recommendations that were included by the pharmacist. And of course, in terms of the format of these vaccination records, in the most common format is still paper, a vaccination booklet or card, but shared electronic systems already exist in 27 countries and territories. So, but of course, we still see barriers in terms of access to these records. And coming to the close of our presentation today, the last point that we surveyed was the perceived limitations to the development of pharmacists' roles in vaccination. And we did that, and we provide here an analysis in this presentation of how these perceived limitations exist in countries without pharmacy-based vaccination compared to countries with, to see how the different perceptions of those various changes when pharmacy-based vaccination services are actually introduced in a country. And what you can see, and I will switch from one slide to the next so that you can see that, for example, in terms of the biggest difference is really, for example, in terms of the perception for a limited patient demand or acceptance for pharmacy-based vaccinations or for vaccine delivery by pharmacists. So in countries without pharmacy-based vaccination, it is perceived as a barrier by 30% of respondents, whilst after vaccination is introduced in pharmacies, this is only perceived by one country, actually 3%. That there is a lack of patient demand or acceptance, which means that once pharmacy-based vaccination is introduced, people do see the value of having access to vaccination services at pharmacies, and the demand and acceptance for this service among patients and customers actually increases, and this barrier practically disappears. Another interesting change is with regards to the lack of confidence by pharmacists to actually deliver vaccines. So in many cases, pharmacists have not been trained and are not accustomed to touching the patient, let's say, or providing a direct service to the patient. And so in countries without this service, this is still perceived as a barrier in 43% of the respondents. But of course, when the service is introduced in a country, this goes down to 19%. So it's really very clear that the moment that the pharmacy-based vaccination is introduced in a country, that many of these barriers change. Those that do not change so much is the limited acceptance by other healthcare professionals, or the limited acceptance by governments, and the limited financial support from third-party payers, from health systems, in terms of reimbursement of the services. So, as you can see, those are still very significant barriers in many places, which of course tells us that we need to strengthen our communication of the value of this service to our colleagues in other health professions, but also to governments and third-party payers. So just to conclude, what we can see is that in the last 4 years since our previous report, progress is evident. And we were very excited to see the results from this survey. And there is a significant increase in the availability of this service around the world. And there's a high number of countries where policy development is underway. So that gives us a very encouraging and very inspiring perspective into the next 5 to 10 years, maybe, in terms of expanding the situation to more countries. The expansion of pharmacists' authority to vaccinate is encouraging, but it's not sufficient, because it's not only about achieving this regulatory change. It's also about achieving the recognition of other professions. It's also about achieving reimbursement for the service, so to ensure its sustainability and equity of access to the service. So it's not only this one moment of achieving this vaccination authority, but actually the advocacy efforts need to continue to ensure that all barriers are removed, including read and write access to vaccination records, which of course are fundamental for us to play a full role, not only in administering vaccines, but also in advising our patients and communities. So expanding pharmacists' scope of practice as vaccinators will ultimately further their contribution to increase immunization coverage and to public health. And a life course approach to vaccination strategies is imperative. And we believe that involving pharmacies in immunization in general is essential to achieve higher vaccination coverage. And what we see is that in the coming months, hopefully year, we will have vaccines against COVID-19, and it will be essential to achieve a high coverage in the population against COVID-19. So it will be important to consolidate vaccination pathways for adults, and especially for older adults and patients with underlying conditions such as NCDs. And pharmacies, of course, are available and ready in most cases to play a role in achieving this herd immunity and high vaccination coverage against COVID-19. So I thank you very much for your attention, and will be available, both Lars Åke and I, for answering your questions. Thank you.
Thank you so very much, Gonzalo, for this very interesting presentation. We have a couple of questions, and the first one, well, I would like to make a comment first, because what we can see from your report and your presentation is that community pharmacy-based vaccinations are rapidly increasing worldwide, and with almost twice as many people able to be immunized in a pharmacy compared to 4 years ago. And also the FIP identified, or the report identified, the key barrier to pharmacist-led vaccination as limited acceptance and support of pharmacists' role as vaccinators by governments and other health professionals, with a lack of financial support from public health systems. And that leads us to the first question. Actually, a change in legislation is being prepared to allow pharmacists in Belgium to administer vaccines. It should be introduced in Parliament by the reopening of parliamentary work after summer. Do you think this report can support this law to pass, and how?
Thank you, Lieven, for that question. We do hope it does. I think that by showing what is the situation and the trends around the world, and especially in the European region, because this question is coming from Belgium, I think that the Belgian Parliament and government will be sensitive to the evolution of this trend, and also will be able to see that in several countries around Belgium, the UK, in Switzerland, in Ireland, in Portugal, in several countries in Europe, this service has been introduced or is being introduced, and has contributed to improving access to vaccination services. and coverage. So we definitely hope that this report will be useful to benchmark Belgium in relation to the neighboring countries, but also at international level, and support this change in legislation.
Yes, I agree with you, Gonzalo, that this report actually indicates that the pharmacist's role in immunization has continued to grow, but of course, so much more could be gained. And there are so many different benefits, numerous benefits, including increased vaccine accessibility and coverage has been demonstrated in so many different countries. So this report is actually a very valuable tool in order to make the development and change happen in your own countries. Of course, legislative and regulatory barriers must be overcome through evidence-based advocacy, and we must address these key issues, including reimbursement. And post-COVID-19, healthcare systems need to change, and pharmacy can take the lead in this change and make actually a very strong professional development of pharmacy linked to the tragic COVID-19 pandemic. Another question is if I have information to share with you from Central America, is that possible to do, Gonzalo, and how?
Absolutely. I mean, this study does include information from countries in Central America, but I think that we would definitely gain a lot from a better understanding of the situation in other countries in the region. So if you can send that information to us, we would definitely appreciate it. My email address, I'm not sure if it's written somewhere, but it's gspinto@fip.org.
Excellent. We have another question. Skills versus legal aspects really limit the practice of vaccination across the globe. Does it mean difference in education and training force to limit the practice?
Well, practice always needs to be based on appropriate workforce development strategies and appropriate education and training. And naturally, we cannot. This is a new role for pharmacists in many countries, and it was not included in our foundational undergraduate training in many cases. So definitely, the competence of pharmacists to deliver this service needs to be set in place, either at postgraduate level as continuous professional development, as sort of an optional additional training that pharmacists may acquire and be certified for before they can provide the service, or as we saw in several countries, I believe 16 countries, this has already been included in foundational training. So that already establishes vaccination delivery as part of the mainstream general training of pharmacists. So when pharmacy students actually graduate and enter the profession, this is already part of their training and their competence profile, let's say. So definitely the training and education is definitely a fundamental starting point for developing this service.
We have several more questions. Here's another one. Do hospital pharmacists have any role in vaccination? And does FIP have any guidelines for PBU? PBW.
What would be that? Pharmacy-based vaccination. Ah, yeah.
Yes, yes.
Yes, there are there are guidelines and publications. Lars Ocker mentioned several of them in his introduction. They are available in our library of publications and on our FIP website. So and in addition to this report that we have just published, there is one that was published a couple of months ago called "Give It a Shot: Improving Vaccination Coverage Through Pharmacists." And also the previous one, the one from 4 years ago, as it was the first publication in this on this topic. It's actually not only the presentation of the survey results, it's a more comprehensive publication, including several case studies from around the world. So that's also a very valuable publication that you can use for that. And with regards to the question whether hospital pharmacists also have a role in vaccination. From our previous surveys, and this one was focusing only on community, because this is community pharmacy is the one that is, of course, more patient facing in the community, where we can have a stronger role in primary care, where vaccination strategies are actually embedded. Because usually pharmacists working in hospital settings, of course, deal with acute situations with hospitalized patients that are in a completely different situation. But of course, if and in that setting, there are other health professions as well that are usually more directly involved in administration of vaccines. But so we do not have data of hospital pharmacists being directly involved in vaccination administration. They can, of course, inform their colleagues in other health professions and in the healthcare team in the hospital about vaccines and the vaccination needs of patients, of course.
Several questions here about education. Should pharmacy-based vaccinations be part of the education in the universities?
Yes, as I said in the previous, in answering the previous question, the moment that these competences are developed at undergraduate level, they become part of the general foundational training of pharmacists. So it's not something that becomes optional or only taken up by a few pharmacists, but it's actually part of our basic set of skills and knowledge. So it does make a difference. Yeah.
Have there been any serious health problems or mishaps reported in countries where pharmacy-based vaccinations are approved?
Very, very, very rarely. And that happens not because the vaccine was administered at a pharmacy, but just because the person developed an anaphylactic shock, for example, to the vaccine. And that can happen, but it's an incredibly rare occasion and effect. And of course, as part of our training, it's not only about the administration of the vaccine itself, but about the management of adverse events and being prepared at the pharmacy with the appropriate equipment and medicines to deal with that situation. But from the evidence that we have, this is very, very rare.
We have another question. How many continents were represented in the survey? Were these statistically significant difference between countries in different continents and pharmacists' confidence to serve as vaccinators?
Yes, all continents are represented in this survey. We usually don't speak of continents, but rather WHO regions. And there's 6 regions in the world, and they are all represented in the study. Of course, the number of countries that participated in each region is different, also because the regions have different numbers of countries, of course. But as I said, the number of countries in the study is 99, and we have, I mean, there are 230 countries and territories in the world, depending on how you count, of course. But so 99 out of 235 or whatever could suggest less than 50%. But in fact, we use the population of the countries as an index, let's say, of the representativeness of the study at global level, because some of these countries are huge and very populated, like China or India, and some others are very tiny states. So what we saw is that the countries that participated in the study represent 83% of the global population. So that's how we consider that it's a very representative study in terms of the regulation and the role of pharmacists in vaccination through community pharmacies.
Gonzalo, here's another question. Have there been cases where pharmacy-based vaccinations have been withdrawn or were not established nationwide after finishing the pilots? Do you know anything about that?
No, we haven't been aware of this situation. No.
Here is another one linked to the current pandemic situation. could you specify a timeline for launching a COVID-19 vaccine?
No. That's a very quick and yeah, I mean, we don't have more information than the one that is publicly available in terms of we know that several vaccines have moved into phase 3 of clinical research, which is very encouraging, of course. This has never been achieved so quickly before with vaccine development. But of course, we don't know exactly how it will develop or when we will have vaccines. But we are hopeful that within the next months or a year from now, we will have more than one vaccine available in the market against COVID-19. And our position is that precisely because it will be necessary to reach out a high number of people, and especially the most vulnerable patients, in a very short period of time, so that we can somehow go back to normal activities and recover economic prosperity and development. It will be very important to increase the vaccination pathways and include pharmacies in the delivery of vaccines against COVID-19.
We have another question. Which country should be used as a benchmark for the training fundamentals, including accreditation?
I will not single out a country, but you have the details in our report that about what is the training situation in different countries, where it is included in undergraduate education, where it is included as CPD or continuous professional development. But of course, there are countries that have a lot of experience that has been shared around the world in terms of pharmacy-based, of training for pharmacy-based vaccination and vaccine-related country roles. Sorry, yeah.
Yes. Let's see.
I see there's a question from Jorge from Argentina.
Yes.
Do you see that one as well? What strategies were thought for fighting or to oppose those that persuade anti-vaccine groups? Yeah, this is a very interesting question as well. Thank you, Jorge. Yes, we see that there is an increase in anti-vaccine movements that have a very strong presence on the internet and in social media, and with very powerful stories against vaccines, spelling myths and spelling unfounded information that doesn't have an evidence base, and also that generate a lot of confusion with regards to vaccine side effects or adverse reactions, for example, or the effectiveness or conspiracy theories related to vaccines. Well, as health professionals, pharmacists know about the effectiveness and the safety of vaccines before a vaccine is enters the market. It needs to go through extensive research and demonstrate both the effectiveness and the safety and the quality. So there is sufficient assurance of their safety and their effectiveness. So, and as the WHO says, vaccines are second only to clean water in terms of their effectiveness and impact in terms of public health and disease prevention. So we do have a role in providing education and information to our communities, to people who may come to the pharmacy with questions, with doubts about something they read on the internet. Oh, should I administer this vaccine to my baby or to my old grandmother? So we do have a role in providing evidence-based advice and countering these growing anti-vaccine groups.
We have another comment from Ariana Mestrovic in Croatia. How about some examples where technicians are vaccinating? In USA, it is allowed in only one state. Do you have any comment upon that, Gonzalo?
Yes, we do have that information in our report. I did not include it in this presentation. In fact, there are a lot of other questions and data that are included in our report that I could not include in the presentation because otherwise it would be very long. But we do have details on that in the report. So I do encourage you, Ariana, to check that there. And thank you for the question.
We have another question. What is the difference between pharmacy-based vaccinations in your presentation linked to vaccines administered by pharmacists?
Yes, that's a good question because it means that in 36 countries, people can go to a pharmacy and be vaccinated, but out of those 36, only in 26 countries, the vaccine will be administered by a pharmacist. In 10 countries, only other healthcare professionals actually can administer the vaccine. So this could be a nurse or a doctor that administers the vaccine at a pharmacy.
We have also a question, what can I, as a pharmacy student, do to campaign for vaccinations and a new role for pharmacists?
Well, you can raise that issue, that debate in your country through your student organizations, for example, to your teachers, to your professors, so that it becomes people are aware that this is the situation around the world, that in many countries, vaccination delivery is part of mainstream pharmacy practice, that it's not a controversial issue at all for many countries that have had the service for many years. In the beginning, there's always some resistance, of course, because there's always resistance to change, to changes of scopes of practice between different professions. People also may be a little suspicious because they have never thought of a pharmacist actually administering an injection. But so that there is a work to be done in terms of changing the perceptions and really shaking up the debate. Because if we think about this, not in terms of, oh, this is not part of the scope of practice of pharmacists, but if we have more vaccine administrators in the community with highly accessible and trusted professions, then we can reach out to more people with vaccination services. Then the question becomes a lot more interesting for health systems, for patients, for immunization coverage results. So it's definitely a question of needs of the population rather than just we wanting to do more, let's say, or to have an expanded scope of practice for no reason. There is a need, there is a reason for this, and it's a very important one.
Yes, and I think it's very evident from the report and from all the different countries that actually we can reach more patients and we can reach the vulnerable elderly and patients at risk. And when we advocate for pharmacy, we actually advocate for our patients. And I think that it's important also to collaborate with the FIP member organizations in all countries, because if we all speak with one voice, so to say, we will become much stronger in our own country. And we share all these excellent experiences and results from different countries. I think that we have more or less covered all the questions. If there are some remaining questions, we will develop the answers and send them to the delegates. Isn't that correct, Gonzalo?
That's correct, yes.
Yeah.
We will go through, I mean, several of the questions that are coming in are, I think that somehow they have been answered by other answers to other questions, but if there are any burning questions that we have not addressed, of course, you can always write to us and we will be happy to answer them.
Yes. So perhaps we should go to the next slide then. I would say that there is established evidence of the advantages of pharmacy's role in immunization in terms of improved accessibility and supply, vaccination rates and coverage, and public's acceptance, trust, and support. And there is a growing trend at the international level for active involvement of pharmacists with vaccination-related services. But of course, education and training is key in progressing development of vaccination and greater advocacy for the public of the health gain of increased vaccination, etc., and also leadership in different countries. And of course, FIP is committed to supporting the efforts of its member organizations in achieving or expanding the authority of pharmacists to vaccinate and play a range of different roles leading to improved access to vaccination and increased coverage rate. What would you like to say as a wrap-up, Gonzalo?
I think you've really covered it all, and I think that the points I highlighted in the conclusions in my presentation also serve as a wrap-up. I think as you said, there is plenty of evidence of how pharmacists can contribute to improving vaccination rates and uptake. So we do encourage our member organizations and pharmacist organizations around the world to work with FIP, to work with other colleagues and other organizations in other countries to really build up an advocacy campaign to achieve that authority for pharmacists in your country, or to expand that authority to more vaccines or more population groups, so that we can reach out more patients and more members of our communities.
Yes, and also working together with main global organizations like the WHO, we actually do support the immunization agenda in order to make healthcare available and accessible to everyone, leaving no one behind. And actually vaccinations can be seen as the first basement, the first fundament in primary healthcare, which will then lead to universal health coverage in the end, if we actually do this in a good manner and as pharmacy can do.
Exactly.
So shall we take the next one? Yes. We are all aware of the significant global challenges presented by COVID-19. And given the current situation with the COVID-19, FIP and its co-host, the General Pharmaceutical Council of Spain, had to take the decision to reschedule the 80th World Congress of Pharmacy and Pharmaceutical Sciences and Spain's 22nd National Pharmaceutical Congress to 2021. However, in this highly exceptional year, without the physical Congress, you can actually join your peers in a highly interesting and engaging virtual event. And I would like to stress that the fees vary from 25 to 100 euros for the whole event, with many sessions, including 4 different plenary sessions where we can learn a lot from what has happened all around the world during this year. So when you register, this will entitle you to access all the sessions during the full event, or the days of your choice. Of course, you can choose to access during one or a couple of days as well. You can access all the professional development events, and you have access to all the posters, abstracts, and short oral presentations. And you will, of course, get the certificate of attendance. You will find everything you need to know about this virtual event on the link provided in this slide. And as I said before, as a member of FIP, you can access these presentations several times at the FIP website as well.
Yes, and if I may add to that, Lars-Åke, is just if you're interested in this particular area of pharmacy-based vaccination and our role, there will be several meetings actually during the Congress, or several symposia and roundtable discussions and high-level discussions and debates about this with experts from countries that have achieved pharmacy-based vaccination, but also from other organizations and other partners. So we do encourage you to have a look at the program and participate in this event.
Yes. So I would like to finish by saying that pharmacy matters. Pharmacy matters today. It mattered yesterday, and it will matter even more tomorrow. So thank you, all of you, for attending this webinar, and a special thanks to Gonzalo for presenting this very important report. And I am happy to meet you soon again at another FIP webinar, and of course at the virtual event in September. Thank you so very much, and have a good time.
Thank you,
Bye.
everyone. Bye.